All right. Hello and welcome again to another Down Fracture podcast, a podcast for talking jaws. Um, Per usual, Dr. Michael Wasson here with Dr. Sam Bobek. Sam, how was your weekend?
It was good. Kind of feel like summer's finally kicking in Seattle. We got a
Oh,
little
really?
over 70-degree weather. I don't want to brag. Pretty nice.
Wow.
How was yours?
Oh, it was nice. We had basketball and other things going on for the kids, and always seems too short, but fun all the same. It is not 70 degrees here, you may be surprised to learn.
I'd figure.
Yeah. Well, again, all of our basic generic stuff, downfracturepodcast at gmail.com. We do have a YouTube channel, we do have Spotify, Apple Podcasts, Instagram. Feel free to check us out there and email us as always. And then we have a special guest with us today. Who do you want to introduce our special guest?
Yeah, no, we have someone that I think anyone listening to this podcast would recognize. We have Dr. Tehrany from Southern California. She is, I think, well known to everyone as a high volume orthognathic surgeon. And just a good person to listen to lectures from. So if you ever see her name on any lecture or national meeting, you should go to that lecture, whatever it's about. So I find her to be really good to learn from. And I was excited that she actually said, yeah, for joining us in terms of talking about this topic. And we're excited that Gabby's here today. So thanks a lot for joining us.
That's a really nice intro. Thank you. Remember that at Amos, Saturday, 8 a.m. in the morning, which is when I'll be speaking to like maybe two people who show up. So thanks.
Yeah, the topic, I didn't forget, I skipped over that, is integrative medicine in orthognathic surgery. And this is a very West Coast topic. I talked to other colleagues in different parts of the world, and they kind of poke fun at my West Coast ideas. And this is one that I think is right in the squarely West Coast orthognathic surgery practice. So how did you get interested in this sort of thing?
I think integrative medicine is something that not just a West Coast thing, but I think more and more as it's becoming more mainstream. And I feel like people are trying to, find a good balance between Western medicine and integrative medicine. And it's hard to incorporate in surgery. And obviously I work for an institution that is managed care, and it's not the type of place where it's typical, to learn about this integrative stuff. So I do it all on my own. I never had any training. I've never had any, clearly we haven't had any in medical school or dental school either. So it's sort of like a personal journey that got me here. But the more I learned, the more I felt like this makes sense. It's something that I feel like I practice in my own personal life in all aspects. So I started applying it to patients, and it works. It helps, at least, in my patients. But if you go to my colleagues within my department and you start talking about glutathione or vitamin D, they'll just kindly reschedule you. So this isn't like the standard of our practice. This is more of a personal thing.
Yeah, I mean, your practice has been, and some of the things you lecture on have to do with outpatient orthognathic surgery and enhanced recovery after surgery.
Yes.
Has that whole world kind of lended itself to other ways to further enhance the
Yeah,
overall patient experience?
you're right. It started with ERAS protocol that I wrote with the anesthesia department. And people have been doing, this is nothing new, and people have been doing outpatient double jaw surgeries, but in a hospital setting, it was difficult to implement that. Just because you've got just so many different parts, moving parts, different anesthesiologists and PACU and pre-op. So when we started with the ERAS recovery protocol, I saw how effective that was for patients. Yeah, it sort of continued after that. And the ERAS protocol started right before COVID. And, a lot of people gave us so much pushback when it started. A lot of the orthodontists would tell their patients, don't let him kick you out. But after COVID, everybody was on board, and everybody started understanding why it was necessary for us to, if medically able to discharge these patients, they started recovering faster. So then that's when I really started getting into, well, what else can I do? How else can I prepare them? So it definitely played a role.
Yeah, it's pretty impressive pulling that off in a big system. I'm at a
It was.
hospital. I used to work for it, but then I spun my practice off. But it was fighting that administrative fight is really difficult. Like changing the philosophy within an institution is such a big lift. It is, kudos to you to figure that sort of thing
Yeah.
out.
Yeah, we had to get a lot of different departments on board, patients on board, anesthesia, and 40 plus years that we've been admitting patients. So it was the protocol. Do you guys send your patients home after surgery?
Wasson, what's it like for you?
Yeah, I'm fortunate. I know what you're referring to, Sam, and that a lot of the medical centers in Seattle did, as an anesthesia protocol, have an overnight stay required for orthognathic surgery, and that had just been in place since the beginning of time. And so fighting that was often a fruitless battle. But I'm fortunate where I am now, where they kind of let the patient and provider decide. And so I usually tell all my patients, we always reserve a bed for you, but if you're up for it and you and your caregiver, whoever's going to be with you, feel comfortable, then I would prefer you to go home. And I think you're going to be happier going home. And it's probably, it's probably maybe like 60-40. I'd say 60% stay for double jaws for sure. I feel like double jaws for me, the vast majority of those stay the night. Single jaws, I'd say the vast majority of those go home same day. You know, if we're just talking orthognathic surgery, that's what I would say. If it's TMJ surgery, different story in some ways. What
Yeah,
about you?
the COVID stuff definitely helped push the admin along in my world as well. Because I mean, I had learned this to be outpatient surgery, but I moved to Seattle and it was very much the spirit of surgery that everyone spent the night. So COVID allowed single jaws to discharge, and then maxillas, and then double jaws. It's just that's been a nice change for patient outcomes for sure.
Yeah.
So
I saw Brian Farrell on your show, and he was talking about, outpatient that their group has been doing for 25 years. That's well, first of all, it was impressive that he was drinking a beer while doing a podcast. I'm like, how am I going to top that? Maybe I can do weights, work
do you have
out.
nice.
I mean, do you have any powdery white substance? Like, we're no snitches here.
Hold on a second. It's creatine, guys. Calm down. It's creatine.
We're no snitches. We
Southern
blame that.
California.
You see that? That was not planned.
So are you giving your patients creatine now? Is that part of this integrative medicine? Because that's a big topic in the fitness world right now.
Yeah. Oh, the conversation goes like this. When I meet a patient for a consultation, and we go through all the technical stuff, and we determine that this patient is a surgical candidate, the point where I start bringing up the conversation is at that initial meeting. And I have a wait list of about a year. So even if you're ready for surgery, it takes about a year for you to get double jaw surgery. I know it's a horrible problem to have. So that's the time that I have to make some meaningful changes. And so when I start the conversation, some people look at me like, what are you asking me? And, they kind of dismiss it, and others really get into it. And so the ones that really get into it, I get into it more, and then we can get into detail. But we talk about the basics. We start with, well, okay, I'm like, all right, well, let me ask you some questions. You know what I'm going to do is, if you don't mind, Sam, I'm going to pick on you, and I'm going to pretend you're coming to see me for orthognathic consultation. I know you have a bit of mild maxillary hypoplasia.
Yep.
See, I listen to the podcast. I'm a
Thanks.
grower.
Yeah, no, we appreciate it.
You're one of the 12.
Yeah.
Oh, you doubled in size. That's great. I'm just kidding. No, we all listen to you guys, and I love the format of, like, just no structure. Let's just talk about what we like. Jaws. Okay, Sam. So let's talk about your diet. So how often do you eat out? What kind of diet do you have?
I've 4 kids, so I just basically eat leftover kid food, barbecue on the weekends, and then anything in the physician lounge.
Okay, we got
Pretty
a lot to
accurate.
work on.
I know. It's not the best diet.
Okay,
Well, how could I change it to make it better?
all right. Well, first of all, I'm not at all judgmental, and I completely understand. But I start talking to them. It's very simple. So I start talking about limiting processed foods, like your kids' chicken nuggets, or that, power bar that you're quickly grabbing that you think is healthy. So just limiting processed foods as much as you can, right? The other thing is avoiding eating all fast foods, because fast foods, they have seed oils, and seed oils are highly inflammatory. So anything that's got like vegetable oil, corn oil, refined oil, that's what they cook with. You throw that out and you cook with healthy oils. So preferably at home if you can, like olive oil or avocado oil. So limiting the amount of processed foods, avoiding sugar. So do you have a sweet tooth? Do you?
Oh yeah.
Okay.
I mean, that is a real problem for me. The bad one is when you have sweets after 9 p.m., like the late night sweets.
Exactly. So then we talk about, well, when do you eat? Okay. What time do you eat? Do you stop eating 3 hours before bed, 4 hours before bed? And after you eat, what do you do? Do you just sit there and watch TV, or do you go on a walk? All these things matter.
Can I jump in real quick? Just
Mhm.
logistics of this conversation. So I've come in for a consult and we've decided, hey, let's do a double jaw. Did I bring up the fact, hey, what can I do to have a more successful outcome? And then are we scheduling
No,
a second visit now, or do you
I
have like 60-minute visits?
I don't. My visits are only 30 minutes, and um I can, in that initial visit, pretty much determine whether we're going to be doing surgery and talk about the things the orthodontist needs to do and all that stuff. And then I bring it up, and I'm the one who starts initiating that conversation. And so that conversation could be as short as 5 to 10 minutes, or if I've got somebody who's really, kind of like Western,
I
then
bet we see the same people in that way. I bet we see some patients that are really into this topic. And I mean, in that world, do you reappoint them, or do you give them like a couple tips and say, hey, go to this website? How do you approach it?
No, and I don't overwhelm people. So I start with the simple things. So I start with the limiting processed foods, avoiding sugar, avoiding dairy, and talking about no soda. Soda is a big one. I'll ask you, do you drink soda, Sam?
I have switched away from my diet soda fix onto carbonated water.
That's great.
So
that's wonderful. Okay,
that's
what
not
do you
soda?
drink? No, carbonated water is fine.
Okay.
Diet soda and all soda needs to stop. So like those are like big changes that I've done, right? I've already talked to them about avoiding a couple of things that are going to make a big change. What do you drink do you drink coffee in the morning?
Coffee. Yep.
What do you put in your?
Coffee, water, and milk are probably about the main things I drink, and carbonated water.
So milk, is this just like regular milk?
Yeah, like I like non-fat.
So pasteurized milk is most people they have a difficult time tolerating it, and it is inflammatory, and it does increase the loss of secretions. So I'll talk to them about maybe cutting back on milk when it comes closer to surgery.
So milk products post-surgery, on the secretion front, do you avoid it?
Yes. Now, when it comes to 2 to 3 weeks before surgery, when we have a long appointment, a preoperative appointment, And that's when I have actual time to discuss things specifically, that 3 weeks before and 3 weeks after, what to do to help optimize. That I'll get into it at that point. And I have time. I have a long pre-op appointment time. But these quick things that I talked to them in the beginning is just action items, because while I'm talking to them, I'm also looking at their chart. And the nice thing about Kaiser is that it's all integrated. So I've got everything. I've got their labs, I've got their history, I've got their medications. So as they're talking to me, I'll look at their labs, I'll look at their hemoglobin A1C and say, oh, okay, I think it's elevated. This is what I want you to do. I really emphasize also mobility and the importance of increasing activity before surgery, strength training, getting muscle, being able to sort of prepare for the surgery. So we'll talk about, okay, so let's talk about your exercise. So Sam, do you exercise?
I'm actually not bad on the exercise department. Better than my diet. Better on exercise.
Excellent, good. So most people, if they don't, I'll ask them to start simple, start walking. Okay. When you walk, once you get that down, then let's get some weights and let's get you stronger. Okay. And then I'll get to a little bit more as to what I do during that pre-op appointment. No, but I don't want to overwhelm them. I've just kind of covered diet, hydration, mobility. I won't go into depth about the supplements at this point, but I'll look to see if they've had any previous blood work with like vitamin D level, and nobody does. So I will order a vitamin D at that appointment, and I will tell you.
At your initial appointment?
Mm-hmm.
Holy smokes.
Well, because I'm in the system, I'm in this like integrative managed care system where, I can order labs, I can order imaging, I could do things that are, that I believe that will help with them getting ready for surgery. So I'll order a vitamin D. I'll always order a hemoglobin A1C if they haven't had one recently. But the vitamin D, I'll tell you, have you guys had a vitamin D level in the past?
I have.
Okay.
Vitamin D is speaking my language right now. This is somewhat of an aside, and I'm not sure if this has come up on our podcast before, but I am very suspicious that non-unions in my world peak when people have surgery at the end of the year. When people have jaw surgery in Seattle in the winter months, it's just that I'm sure it is multifactorial, but I have a hard time not believing it's kind of the worst time in terms of vitamin D levels in the course of a year, right? Like because my understanding of vitamin D deficiency, there's a high rate of it at baseline, and it even gets worse at certain parts of the globe. Like you get north, like Seattle or parts of Canada. It's basically everybody's vitamin D deficient. Is that the correct understanding of it?
You are correct. Now, the interesting thing is I'm in sunny California where it's right. And I will tell you 90 to 95% of the time when I get a vitamin D level, it's severely low. Like I'm talking about like the cutoff is about 20. And by the way, I don't even agree with that cutoff, but cutoff is 20 and I'll get like 7, 6.
And we're talking adults, you're talking mix of teenagers, just adults, everybody.
That is correct. That is correct. So there you go. That's one actionable item. I got vitamin D level and I tell them I want you to start supplementing with 5,000 international units. So I don't go into my vitamin talk. My colleagues make fun of me. Are you gonna do your vitamin talk again? So I don't really go into my vitamin talk in detail. I just say, okay, here's one thing for you to do. Supplement. I got the vitamin level. It comes back, it tells me it's low, and I send them an email or a message, please start supplementing. I feel very strongly that it does make a difference, but it's not just the vitamin D, because you really need like a magnesium and K2 along with it so that you can actually absorb and utilize that calcium. So the K2 ensures that the calcium actually is going into the bones. But then if they want to get into, if they ask me at that point, oh, well, what else do you recommend? What other supplements do you recommend? I'm happy to get into, but again, I don't want to overwhelm people because I think this topic is really overwhelming, and this whole like industry is overwhelming. And I am not at all like the expert in it, but at
Yeah,
least,
I mean, for me at least, that's what the struggle is a little bit, because I like keeping things as simple as I can to be like, hey, how could I get more healthy going into surgery? There's probably, 80%. There's a few things that kick you into an 80% better category, right? Like, I mean, vitamin D seems like low-hanging fruit, obviously healthy living. Um, do you just do you,
Not smoking, limiting alcohol,
yeah,
limiting
is it just
sugar,
as simple
yeah,
as that right off the
limiting
bat? And
processed foods.
yeah,
Yeah, I mean,
absolutely. I do right off the bat. I mean, if you're a smoker, I will say you have to quit. You have to quit smoking 6 weeks before, 6 weeks after. And I'll tell them that I will get a nicotine level. I mean, I'm very strict about the smoking, because like, why would you put me in such a disadvantage, or yourself in such a disadvantage, so I will tell them 6 weeks before, 6 weeks after. Surprising THC doesn't have the same effects on wound healing the way nicotine does. So I'm okay with that. But nicotine is an absolute no. Alcohol 3 weeks before, 3 weeks after. Again, I'm just preparing them, it's just, again, inflammatory. But the one thing that I tell them, and I will calculate, this is where I'm not going to do this to you, Sam, but this is where I actually calculate their BMI. And if it's above, if it's above 30, then, there is actual literature that shows that you're going to do statistically significantly better when it comes to anesthesia if your BMI is less than 30. So, I give them exact number. All right. So you weigh 200 and something, you need to lose 20 pounds in the next year so that you can make a significant difference in the way you recover as far as anesthesia goes. So those are a couple of things actionable things that I'll give them at that point. And it's not to overwhelm them, it's just to prepare them. Do you guys
Yeah.
operate on patients? Like, is there a BMI cutoff?
I don't have a BMI cutoff. I'm peculiar.
no, I don't.
Yeah. No, I don't either. I don't. I have OSA
Oh, that's
patients,
good to hear.
but I don't either. But I will at least tell them the statistics. And I will have patients come back 6 months or 8 months later, and they've lost a significant amount. I did what you said, and I'm like, great, But and then of course there are those that they're like, they come back and they're like, I'm so sorry. I'm like, no, it's okay. I'm not judging you, and these are just guidelines that I'm trying to help you. But yeah, I get it. Not everybody can. Of course, a lot of people are on Ozempic now. So we do have them. I'm fine if Ozempic is needed to help you lose weight. But we do have them stop it before surgery as well.
Yeah, I mean, I like the idea of taking advantage of the time they head off to ortho and the time they're kind of like waiting on insurance and that sort of thing. Yeah, we were hearing a lot about the 1 year wait or the 1+ year wait. Do you have a few nuggets for people who are just show up and they're ready to go and you have an opening in a few months? Is that a real life scenario that presents itself or not really?
It is, if you're lucky, if like that day somebody happens to cancel. And there are some cancellations, so we'll put people on the wait list.
Yeah.
But typically it does take about a year for double jaw surgery.
Got it.
Lower jaw alone, I can kind of sneak you in 4 or 5 months, but double jaw is about a year.
And it's pretty much the same advice on that timeline. Diet, lifestyle, supplementation, that sort of thing.
Yeah, exactly.
Got it.
Exactly. And then, when they are ready for surgery and it's the preoperative equipment that's already booked, which is like 3 to 2 weeks before surgery, where we do the CT scan, the scanning and the teaching, the measurements, all that. That's when I'll really get into things in more detail with them. And some people, like, that could be a really long conversation.
No, I bet. Can I ask, has mental health come up as part of that?
Absolutely. Yeah,
Um,
absolutely.
because I think there's some optimization in that department that helps set people up for success. Do you bring that up, or do you refer to someone to bring it up, or how does that discussion go?
I think post-surgical stress management is really important.
Yeah.
And I do talk to patients about what they can do to just, manage the reality that I just had jaw surgery. I look like a monster. I feel horrible, and I'm emotional, and my sleep is off, and I'm hungry, and I'm cranky, and I'm like, why did I do this? I'm always going to look like this, And so I teach them what to do. I do give anxiety medication to get them through it, but there's so many other things you could do. Breath work, that's real to get you into more of like a parasympathetic state. Meditation, that's where exercising helps, because I get my patients. So that's another thing I do is I get my patients back to mobilization fast. So first week, walk twice a day outside, 15 minutes. The second week, if you are used to it, then I'm okay with you starting with weightlifting, going back to the gym, and getting back to like lifting by week 2. And I used to say like 6 weeks of no weightlifting, but I did surgery on my scrub tech, and she was like back in the gym week 2 with 25 pounds in each hand. So if your body has that muscle memory, that ability, I mean, you can get back to your baseline fast. So
Yeah.
exercise is great because it's great. Like for mental, exercise is more powerful than, for getting those endorphins out than anything else.
Well, that's what kind of what I was getting at is, I mean, a lot of the stuff in terms of healthy living, good sleep, eat well, exercise, it just improves your mental state in general, which after surgery, we change all that. And
Yeah.
I definitely agree that there's a lull in post-op jaw surgery where people have a hard time, and the occasional patient really has a hard time, just because they're out of the routine.
But also their circadian rhythm is off, so they have this surgery now, their cycle's off, and so that they can't sleep at night. So now they're like, sleeping during the day, they're not moving, they're not going outside, and so their whole cycle's off, and you get depressed. I mean, one of the reasons why I felt like the ERAS protocol was so important is because when you're stuck in that hospital, and then you've got all these lights at night and all these things that, they come in every hour to get your vital signs, that's all disruptive. So you're not sleeping and recovering. So if you are discharged and you're in your comfortable bed and you're able to sleep and recover, and then during the day you go outside, you get your circadian rhythm back, it actually helps with depression. It helps with like pain. It actually reduces the pain threshold, and it helps just getting you back to recovery much faster. Impaired sleep is a big deal, and it plays a big part in this post-surgical recovery. So I'll actually get into like the details of sleep as well with patients when it comes to right before surgery, because I think regular sleeping time and getting enough sleep really helps with the recovery post-surgery.
Yeah, I mean, a lot of the ERAS protocol stuff spoke to me for those reasons. I mean, people definitely do better on their own. I mean, if they need to for safety in the hospital is reasonable, but there's so many good advantages to getting back into your normal routine. All right, so we got the initial consult. You do the general well-being, help them out, and then they come back for recall visit. Do you just leave that open-ended, by the way, or do you set them up for a recall visit at the initial consult?
If they are ready to go and their teeth fit and everything's good, then I don't need to do a recall. I'll just put them on the schedule. And so our next appointment will be that pre-op. But if there's any issues and I'm like, come back, I want to make sure you're on the right track, your models are fitting okay, then there will be a second recall visit. Yes.
That's right, because the insurance, you're treating Kaiser patients. Got it.
I don't deal with,
Okay.
lengthy insurance pre-authorizations or writing letters or any of that. I don't mean to brag.
Oh,
I
yes,
see
you
why
do.
you have so much time on your hands.
I
Okay,
have
see, I'm at
twins.
the.
I have twin boys. I have no time.
How old are your boys?
They're 9.
Are they
Ugh.
playing sports right now, or?
One of them is in club soccer, which like, I'm sorry, but
That's crazy.
they should just make that illegal. Like, if I know, it's insane. Like one day, one weekend, he'll be in Lancaster, like 2 hours away, middle of nowhere. And like this boy plays soccer all day in summer camp, and then he goes and he does like privates in the afternoon. And it's, anyways, I'm gonna stop digressing, but he definitely does not have a vitamin D deficiency.
Yeah, that's great. So there's the pre-op visit. You get into detail
Mhm.
in supplementation. Is that what I'm getting at? I'm hearing
Okay.
that there's a lot of that.
Okay. So the supplementation is a tricky one, because if a patient, there are some patients that come in and they are more informed, they are more knowledgeable about supplementation than I am. Like, I learned from them, and those are the people that I'm like, okay, tell me more, you know. But it depends on your comfort level. The one thing, the baseline is I ask is for vitamin D, and then magnesium L-threonate, just to help with, you know, sleep at night. I mean, those are the two that I feel like are important to talk about. But if you really want to get into my, as my colleague Dr. Bundy calls it, your vitamin lecture, I can get into my, really quickly into my idea of what I feel like, what vitamins I think people should know.
What are the biggest ones to do? I mean, because for us early learners in this stuff, I mean,
Yeah.
I feel like if I gave people a couple tips, they would gladly take it. Actually, I feel like
Yeah.
people would like to hear that.
I'll make it simple. Okay. So probiotics, they help fight infection, and they play a role in like nausea and vomiting, right? You can do it in yogurt form, although I like for it to be like fermented dairy. So, you know, like Greek yogurt, things like that. But if having a probiotic on board is great, you know, supplementing with that. Glutathione, if I had to choose one thing, I would say glutathione, because it is like the master antioxidant, and it really helps promote wound healing. And glutathione is one of those things that I think that you know, we make our own glutathione, but supplementing just helps with surgery. And then if they really want to get into more, like, another easy one is collagen. You know, hydrolyzed collagen, that really helps with tissue repair, wound healing. Those are the simple ones.
Yeah, because people have asked me a lot of questions about peptide, not a lot, but there's a lot of the people who ask the questions about peptides have a lot of questions about it. And I quickly get to the limit of my knowledge, like almost immediately.
Yeah, so I don't think of peptides as supplement. That's a whole different category. That's like next level. And I never bring up peptides, but I know a lot about them. And this is how I learned. This is a true story. I had a patient come in, and she was on Ozempic. She had double jaw surgery and genioplasty. And, you know, you could tell when certain surgical movements that you do, you're like, yeah, you're going to really swell up. And she came back a week later after her surgery, and I was so surprised. She had such minimal swelling. I did a huge counterclockwise rotation, maxillary impaction, segmental, and like genioplasty, and like, you know, and she had minimal swelling. And then I looked inside, I looked at her incisions, and I looked at her and I'm like, what did you do? You know, and she's like, what? I'm like, is it the Ozempic? But I had plenty of patients that were on Ozempic, and, you know, they didn't have the same type of healing that I was seeing on her. And she goes, well, you know, the last time I was at my clinic, whatever clinic she was at, she's like, you know, they added something. They said that would help me with surgery. I'm like, you better go find out what it is. So she's in this process of going back to find out. That day and the next day, I'm just like researching and trying to look for what's going on. And then I found this podcast where it says heal like a Wolverine. And I started listening to it. So I'm like, that's what she did. She's basically healing like a Wolverine. And as I'm listening to it, she sends me a text. Yes, I give my patients my cell phone number. She sends me a text that, oh, it's BPC 157. And I like screenshot and I'm like, that's exactly what I thought it was. And so I started looking into more about BPC 157 and peptides, and just like, it was like a whole new world of magic that I discovered.
Literature lags on this stuff, right? Like what we're talking about is
Yes.
more like real practice, and
Absolutely. Yeah,
you know,
let's be so BPC 157, it's one of the most probably studied peptides, but it's animal studies. And in animal studies, there's some real healing potential. I mean, I'm talking about, there's this rat study where they cut off the Achilles tendon in these rats. And
that
half
sounds
of
mean.
them,
Poor
yeah,
rats.
yeah.
There goes our PETA sponsorship.
I don't condone cutting anything off of rats. But so they cut off the tendon, and then half of it they gave BPC 157, and they just injected into their stomach. And within a month, the rats with the BPC 157 started walking again. Like basically were fine, they healed. And then the other ones were just were done for life, because Achilles tendon does not heal by itself. And so there's a lot of animal studies. There aren't any, well, I know right now, there are several clinical human studies, but nothing, it's more private. I mean, the FDA is not, let's just say they're not going to patent it, because they can't make money. So the FDA is not going to put a lot of money to research and, into this. But
I mean, I think a little bit of this has to do with like, like nerve injury literature. People have nerve injuries, and then there's just kind of like, hey, why don't you try these vitamins? And it's very like rat study type of thing, like pseudo-L-carnitine and those sort of things. And people, we give that advice, but it's very questionable on the dose, and
yeah,
we're always like hoping that there'll be some study that really drives what we do, but it hasn't.
right.
It's
No, you're
just
right.
doesn't seem to materialize, I guess.
Right. And so that's why I never bring up peptides, but I've had 3 patients now that they did it on their own, and they're in this wellness field. And I'll tell you, all 3 of them have had pretty minimal swelling. And what it does is basically increases fibroblasts. It gets like the growth factors for muscle repair, helps with tissue healing. It's a bunch of stuff that it does. But I've never been the one to actually initiate this talk. It's always been, okay, well, you're in this wellness. Well, this is what I also do. So,
Yeah.
but I think once there is more clinical human studies, that this is going to be like standard practice in about 10 years.
Yeah, no, that's interesting to hear. Can I backtrack just slightly? Because you had said you take vitamin D levels initially, and you advise people to take the vitamin D.
Yeah.
How many on follow-up actually follow your advice? How many do you, when you retest them, has it changed? Half? Roughly.
More.
You feel like they're into it?
I think so. I think people listen to me. Yeah.
So when you're testing the vitamin D again, it's much better.
Most patients, I'll be honest, I don't retest.
Oh, you don't? Okay, sorry.
I don't retest. Yeah.
Okay.
But they tell me that they supplement. I did retest somebody recently, and I can't remember why I retested them. Oh, because they were so severely low. And yes, it had increased to like 30 something. So yeah, but I typically don't retest. I
Got it.
my patients that they listen to my advice, because it's for your own good,
Yeah, because it's the other part of this stuff. It's patients that are interested in just doing another couple of things to really get better might very well be the patients that follow all the instructions anyway, right? Like
Yeah.
those are the ones that are taking medicine and
Well,
not
and
chewing.
I would throw in there that we talk about attitude all the time. And if these patients are engaged and interested and involved in their care, their attitude alone I mean, we talk about that all the time, Sam, and just the patients who have the kind of victim, woe is me type attitude versus the patients who have the attitude of, I'm going to attack this recovery. I'm going to be involved in it. I'm going to take this in my hands. This is a challenge and not a burden. Those patients do better. And like you're saying, I feel like there would be some overlap of the type of patient that would fall into all of those categories and receive all those benefits. So that would lead me to, other than the three patients you mentioned, like, could you speak to some other of the benefits? Because I'm always interested in this stuff, but I'm a little bit skeptical by nature. Because I mean, like you mentioned, like collagen. But I mean, if my biochem days serve me right, I mean, collagen is essentially just what it's a few amino acids and overlap over and over again, right? I mean, so when you
Mhm.
it's not actually even absorbed as collagen. Like you would digest that, break that down to amino acids, and then use the amino acids. So where is the benefit of taking collagen
Collagen
versus
versus, yeah, like,
protein? And then, I mean, my other thing is like all of these things sound good when you say, hey, look, here's what a deficiency in protein looks like, or
mhm,
here's a deficiency in glutathione, and here's the repercussions of that. But I'm always skeptical, and especially like the health and fitness world, when they say, and water and protein and creatine, all these things are perfect examples of, hey, if you're dehydrated, you don't recover well. But then people take that to the extreme opposite of like, I have to drink so much water in excess, and you're just, in theory, excreting a lot of these things. So I guess can you speak to that in any context? I know that's a tough thing to answer, and it's a tough thing to study. But do you have thoughts on any of those aspects of it?
that's a great question. I mean, that that is a great question. And the difference between, because I always thought, oh yeah, well, collagen is basically protein. The difference is, I think collagen's missing like tryptophan or one of the amino acids, but there are specific things. So you can't really take it as a complete nutritious source, for protein. Because that's the other thing I do is I ask my patients to increase their protein intake during the perioperative period, before surgery and after surgery. But collagen has a specific role in tissue healing. Okay. So, yeah, do I know like the exact mechanism, or do I know that this is, scientifically backed and this and that? I don't, but these are things that I think like that makes sense, increase your protein, take the vitamin D, it helps with bone healing, drink electrolytes, drink water, don't drink soda. All these things are things that I can recommend, and they're not bad for you.
Yeah.
They're not bad for you. So, as long as they're not harmful, I'm pretty comfortable talking about these things, even though I don't have the background. I don't have a nutrition background. I don't have, I mean, if you think about it, like, we don't know the first thing about vitamins, minerals, or any of that. I didn't learn any of that stuff. I was too busy memorizing like drugs in medical school,
Right.
right?
And I agree with your sentiment. And that kind of was going to be my follow-up question is I'd share your opinion of, if it's not harmful and it can only help and it's not outlandishly expensive,
Mhm.
why not? If patients are willing to do it, if
Yeah.
anything, maybe it turns them on to a healthier lifestyle, a healthier attitude, has any kind of positive mental health aspect, and taking that aggressive approach of being involved in the care and not a victim or a burden and attacking it. But I guess my other question would be in the context of, we all do our surgery our way. We all have our medications. We have our own post-op instructions. Are there any of these things that would throw Samurai off? Like, do you see side effects, or do you see other changes that if tomorrow Sam and I start implementing some of these things, would we say, oh, something unusual happened? Do I attribute it to the supplement or the peptide, or is there anything that you've seen that would skewer post-op
Yeah.
results beyond the wound healing and swelling that you already mentioned?
So one of the things that I have seen, increased bleeding.
Hmm.
A lot of these supplements do increase bleeding intra-op. Like a good example is coenzyme Q10. Coenzyme Q10 is a great supplement, and it really helps. There's actually some good studies that it actually helps stabilize implants, not oral implants, but like breast implants and post-surgical patients. There's some good studies with coenzyme Q10, but it makes you bleed. So I could see it, you know, during surgery, like if somebody didn't stop it in time or it was still lingering, that, you know, being a, you know, additional side effect. But I think most, besides that one, I really haven't seen anything else.
No one's like grown a second ass or anything.
Only once, but
Did you say
that's them in
grew a second
LA, you
ass?
know?
Is that
Come
what I
on.
just heard? I
Guys,
would
You
get
it's
look
that.
LA.
sleepy. You look sleepy there, Sam. I had to throw something at you a little bit there.
Yeah, I think I don't think that falls into old man saying. I was just more thrown off by the whole general idea. I think when it comes to it, definitely, I think perioperative instructions. For me, I'm always aware of skirting the line between too much info and overwhelming them, and they get no info out of it versus the right amount. And so, I think a lot of this kind of falls into that. So for the right patients, I bet you a lot of this is great. Um, and so I think it's a good time looking at the overall patient care and how they can supplement. Do you add anything post-op, like six, let's say late post-op, like when they get back into it, like 6 weeks and 6 months? Are you adding something in addition to these in terms
I'm
of it?
not. I'm not. One thing I do post up where I think is a little bit different and is okay. So one thing that I've changed because of this practice is the first 2 days after surgery, I ask them to be on bone broth. So I think one is I don't want any of that residue in their fresh wounds. And two is I think bone broth has like great source of protein, great source of collagen, and it's easy to swallow and it helps with nausea and vomiting, all that. So I'll do that. And then doing the protein shakes, and my rule for protein is 6 ingredients and less. I don't want you to do any of that Ensure or pre-made stuff that those are like really those are really bad for you, by the way.
I mean, our food at the hospital is all high fructose corn syrup.
Yeah.
It's the most unnatural menu available. And I
Yeah.
mean, I consider Seattle to be a little bit health conscious of a city, but I think the no dairy thing post-op is a good insight. I think that's interesting because
Yeah.
a lot of people complain about phlegm. I think mucus plugging, those sort of things are real phenomenon.
Yeah.
What do you think about gaining strength and bone, like intentionally jaw strengthening exercises? Do you do any of that, or
Jaw strengthening
yeah,
prior
like
to surgery?
after or prior, either way?
Uh, ooh.
No.
I had a patient that he later confessed, after a maxillary advance, it was quite a big advancement. He had a non-union at about, 7 weeks. I'm like,
Yeah.
And I had used like one of those real sturdy prefabricated surgery for dummies plates. You know what I'm talking about?
Yeah.
Yeah. And I'm like, how did you break this big piece of plate? And he started crying and he goes, I'm so sorry. I ordered one of those jaw exercising
Jaw
things.
exerciser.
Yeah. And so
Anyone hasn't seen that, they should check that out.
yeah.
Not that I'm a proponent of, I just
Right. No, I don't. I
internet's a
actually
crazy
don't.
place. And the fact that that exists as well. But
Yeah, yeah, no, I don't. But there is one thing that I have been thinking about implementing. I just don't I think people will just think I'm crazy. So I don't want to push it. But there are some studies based on oncology patients that if you have them fast 48 hours before surgery, then they have this like surge of IGF-1, and it really helps with them recover. So if you just ask somebody not to eat anything for 48 hours before surgery.
oof, just
That's a tough
torturing people
ask.
harder.
I
I'm not,
haven't done that.
Oh.
Yeah,
you let me know how
I
that one
haven't done
goes.
that. I
That's a
haven't done
tough
that.
ask,
Yeah,
man.
it's a tough ask. Yeah.
What about medication interactions? Is that a concern with any of these things that you've utilized?
Um, I think, yeah, I think that if somebody's on a lot of medications, and they've got, it's like way above my head, then I will say, okay, well, see if this interacts with your medication. But most people that I do surgery on aren't on that many medications. I mean, some immunosuppressive medications, things like that. Or if they're on like a lot of medications, I know a good surgeon knows how to cut. A great surgeon knows when not to. There you go. That's my old man saying. So
I love it.
yeah, there you go. I probably, yeah, won't talk too much about, adding coenzyme Q10 and things like that, because yeah, I don't know. And that's a possible interaction. And, these things can also have interactions with each other. So,
Yeah.
Do you offer a handout? Because I mean, this is a lot to take in for us, let alone patients. Like, do you have a handout that goes through some of this stuff, or is it on a website like Sam was asking earlier?
again, I don't want to overwhelm people, and I don't want them to think like you have to do this. I do have a really lengthy article that I wrote for Orthodontic Society. Like, believe it or not, the orthodontists are like all over this and they love it. The
I
surgeons
believe
not
that.
so much, but the orthodontists
Yeah.
are
This sounds totally right. I believe what you're saying right there.
like when I went to present this at Amos, I was like, um, crickets, and everybody was just kind of like, yeah, that's great. Okay, next presenter. Um, but when I went to present at with the orthodontist, they were just like, oh my God, this is amazing. And can you write this up? And da, da, da. And I'm like, okay, these are my people. So I have that article, and if I feel like a patient's really into it, I'll give them that. But I try not to do anything to overwhelm them or to give them any handout that's got like, my personal recommendations of what I think that are helpful. But look, most people, let's just be honest, most people in America have a really bad diet, okay? And just if I could change them drinking soda, not smoking, and just exercising, moving, and maybe improve your hygiene before, and things like that, then maybe changing 3 or 4 things, I think I'm going to make a big difference. And
Yeah.
and I think that patients actually spend so much time and effort nowadays, like looking for a surgeon out there and looking at how many counterclockwise rotation are you going to do and this and that. And I mean, they're so knowledgeable, right? They know all these things. And I'm like, just take that effort and put it into yourself.
I
It's going to serve you.
100%.
think that is some wise
100.
insight right there. Because I think when you're going into an anxious situation, getting some control is important. And what you can control in your life is your diet and exercise, the different things to make yourself healthy. And all that's going to do is help you out, right? And you
Yeah.
can't control the variance from the outcome of surgery to the surgical plan, right? Like, I mean, you can try to control that, but getting yourself otherwise healthy has a lot of benefit in a large group of patients. So I think that's great.
Yeah.
Yeah, I love it. I love that aspect of it. I think you said that well. It's like, why not? Like, stop going on forums and having people judge you and try to give you unsolicited medical advice, and take that same time, energy, and effort and read up about how to be healthier and heal better. And I mean, yeah, improve yourself. I think that if you could say that to all the patients for us, I think that would be very helpful. I
Yeah.
don't know. Um, all right, Sam, you got anything else, or
Well,
did
I had one other
we?
question, I think. So if you
There you
look
go.
at
There we go.
that,
Yeah. Brian
what is that,
Farrell.
like a 60-pound?
Yeah. Pretty
Nice.
much.
If you had to have a teammate in this effort, so let's say you were busy in practice and you didn't necessarily have as much time to do this, what direction would you point people? Would it be you know, primary care in my world, those guys are busy and are
These guys don't
very
know anything about this.
administratively oriented in their medical practice? Where do you send them?
Okay. So people who know about integrative medicine, they're very expensive and very difficult to find. So if I were to send them somewhere that could help them, I would send them to like and I don't have access to this at Kaiser, but like a myofunctional therapist. I think like just having a myofunctional therapist on board really helps. And then learning about it yourself, because like I honestly I learned from podcasts. I didn't learn from anybody else, but trying to find someone who is knowledgeable in this, nutritionist, that's what I would send it to, an integrative medicine or functional nutritionist.
What's holding you back from having that in your office? Is it just
I work at Kaiser, so I don't have the kind of practice where I can dictate. I mean, I have a lot of autonomy, but there's a structure. And
Yeah.
so I don't even have a myofunctional therapist at Kaiser.
so nutritionist? You think you?
Yeah.
All right.
I
Yeah.
think
No.
nutritionists are more knowledgeable than internal medicine doctors. Yes.
Yeah. Well, great. Yeah, that was the last nugget. I feel like there's some good things to learn from there, and a lot of different branching roads to discuss. So, yeah, I feel like I'll have one or two that I'll start trying out, just going right into the future. So I appreciate you joining us.
Absolutely. It's been I'm such a big groupie. Like I said, I'm a big fan of you guys, and I hope you continue doing this.
Yeah, no.
You could donate to the cause if you'd like.
I think that's what
Since
she's doing
you
today, right?
since she ruined our PETA sponsorship, you could buy us some fast food at least.
Yeah, the sad
All right.
rats. That image had left my mind. The poor rats without Achilles tendons just limping around their cage. But yeah, no, I appreciate it. I think taking the time out of your busy schedule to talk with us. I know you with kids and everything, it's just busy. So donate an hour to help us out. We appreciate it. And look forward to kind of learning more about this as we kind of continue trying to figure out how to do jaw surgery.
Thanks,
Yeah.
guys.
Yeah, thank you again. Again, that was another Down Fracture podcast, a podcast for talking jaws, downfracturepodcast@gmail.com. Thanks again, and we'll see you next time.